am an orientation and mobility specialist.
I'm a lawyer.
I'm a firefighter.
I'm an advocate.
I'm a sister.
I am a mother.
I'm a friend.
I am me.
I have bipolar disorder.
Depression.
On borderline personality.
I'm not embarrassed.
1 out of 5 people lives with a mental health condition.
We're all people, and if we talk about it, there's hope.
Hello, I'm Karl Shallowhorn, Chair of the Erie County Anti-Stigma Coalition, and on behalf of the coalition, I'd like to welcome you to the 7th in our series of Facebook Live events, this time focusing on the state of stigma, understanding mental health in older adults. In our society, older adults are faced with many challenges, those related to the aging process, such as decline in physical health, financial concerns related to living on a fixed income, and dealing with issues of grief and loss over significant others, family members, and friends. But another factor in the lives of older adults relates to their mental health. According to the American Association of Geriatric Society, it is estimated that 20% of adults over 55 live with some type of mental health concern. So today we're going to be exploring this topic with 3 individuals who work on behalf of this population. Before I introduce our panelists, here are a couple of housekeeping rules. Our program is 1 hour. During the course of this time, if you have a question or comment, please type it into the comment box and we'll respond accordingly. Today I'm joined by our 3 panelists who will each provide their own perspective on this topic. First, we have Amanda Bender. Amanda is the Long-Term Care Coordinator for Erie County Senior Services. Amanda has worked for Senior Services for the past 13 years, starting out as a case manager. Amanda now oversees the case management system, New York Connects, Senior HEAP, Caregiver Services, and Transportation. Amanda has her master's degree in social work from the University of Buffalo. We're next joined by Melissa Abel. Melissa is the Deputy Director of Amherst Center for Senior Services. She's been with the center for since 2001. Melissa oversees administration of all direct member contact programming, including classes, center events, volunteer opportunities, social work and outreach services, and public relations. Melissa earned a bachelor's degree in health and human services, social gerontology from the University of Buffalo. Finally, we have Nicole Dunlap. Nicole is the clinical supervisor of the Dale Association's PROS Center for Wellness, which is a comprehensive recovery-oriented program for individuals who are 18 years and older with mental health conditions. Nicole coordinates the PROS Center for Wellness's group therapy catalog, which runs over 50 groups a week with topics such as challenging negative thoughts, building emotional strength and overcoming social anxiety, and therapy modalities including dialectical behavioral therapy, schema-focused therapy, cognitive behavioral therapy, and art therapy. Nicole specializes in teaching people suffering from mental health symptoms or substance coping skills in order to attain improved life functioning. Nicole earned her bachelor's degree in psychology and her master's degree both from Nazareth College of Rochester. So welcome, everyone. So to start off, I'm going to ask a question for all of you, and perhaps we'll just start with Amanda. So this question is, what are some of the reasons you believe there's an issue of stigma around mental health for our older adults? So Amanda?
Sure, thank you, Carol. I believe that a lot of the older adults that we work with grew up in a time where they felt that disabilities or mental health issues were frowned upon. So, they tend to keep their feelings or any type of depression, anxiety, those types of things, they keep it in. They didn't feel free to express themselves or to seek help. And also it was sometimes seen as like normal aging. So, okay, I'm getting old. It's normal to feel this way, or these are just what you go through as you age. It's part of the normal aging process. Or they might even be in denial. Maybe, they don't really know what they're going through is a formal condition. They don't know they have a problem, and they don't know where to go to even address the problem.
And so Melissa, how about you? What's your thoughts on this?
I agree with Amanda.
A lot of it is some of the negative stories they hear. There's just the stigma attached to it. They may feel embarrassed with family or friends if they don't think that they're going through something very similar. If people don't talk about it, they don't acknowledge that it's happening. They think that it's just them or it'll go away. They may fear that losing their independence, that somebody may take them out of their home or that they're not well. So a lot of the seniors that we talk to, they just feel that they're not going to have that support from family. They don't want to burden them anymore. So they just don't want to acknowledge that it's happening.
It's interesting, Melissa, they say the idea that, those who, go to your programs don't want to burden their loved ones. And I think that's sometimes what we hear. Where do you think that comes from? Do you think that it's truly a matter of being a burden? Or do you think it's just their perception versus what family members actually do?
Right. I think it's just their perception, that they know that their family members are busy. They don't want to, reach out for help for every appointment or take on another doctor's visit. They may feel that there's other physical and other chronic illnesses that kind of take precedence. And they just think this is just one more thing that they have to ask help for.
Absolutely. So thanks for that. So, Nicole, what are your thoughts on why you feel there's stigma in older adults?
So older adults grew up in an era where mental health treatment was quite different than what it is right now. And in that era, it was very common for people to have experiences where their loved ones, their caregivers, and their family members, if they had a mental health issue, if they had a disability, they were often institutionalized or committed. And so they might have experiences of family members just disappearing to get mental health treatment. And there was often a lot of stigma, something that was a shameful family secret. And so it was very much emphasized, this is something that we don't talk about. You shouldn't talk about this. We shouldn't talk about so-and-so. And some of those attitudes and some of those memories continue to persist, and they grow into adults who feel like mental health is something that should be secretive. You should pretend that you're okay if you're not, and the treatment options might feel scary to them. They might not understand some of the therapies, some of the treatment modalities that are here today that are very helpful and very successful in treating different mental health conditions. I think in addition to that, there is an idea that mental health has to be very dramatic. So if I'm just having some depression or if I'm just having some anxiety, that's just how I am. And I don't need mental health treatment until it gets really, really bad. So we have maybe some ideas, attitudes, or beliefs that are changing and have changed with our society, and our older adults remember things differently, and sometimes those memories and beliefs that formed in childhood will continue to persist in adulthood and can add to stigma.
Which is interesting too, Melissa, when you think about it. So what I'm hearing you kind of say and underlying is that there's fear. There's a lot of fear of older adults of what could happen, being institutionalized, because of what they're going through, and they don't want to share that with family. So is that kind of what you're saying?
Yeah, or just the idea of, oh, my mental health isn't that bad. I'm actually okay because I might still be able to function. I might still be able to live my life in this way. And if it's not quite to a severe level, then I must be fine. And not having maybe an understanding that mental health symptoms are significant, even if they're not very dramatic or if they don't have a huge impact in different domains of your life. If you are suffering, that's significant and you can get help.
So for all of you, once again, another follow-up question is, as far as barriers, we know that with different age groups and different populations, we talk about barriers to getting help with mental health. So what are some of the barriers that older adults face? So Melissa, how about you? What do you think about barriers?
A lot of what we see in the clients that we've been working with, a lot of it is healthcare costs, co-pays. They're already on a limited income. So for them to take on more co-pays can be very difficult. They have to make choices between, taking on another doctor or another counselor. Transportation can always be a concern as well, especially some of the clients that we work with in the rural areas, where just getting to a counselor can be difficult. And again, still that feeling of you're asking somebody else to help you again, to take you to an appointment or to a weekly session, or not feeling like, that they need to be a part of that. A lot of can be denial. Again, it's their own biases, as we've already spoken about. It's the way that they've grown up and history or family members that they have those stories in their heads and they just don't want to be portrayed that way to their family members or peers.
So before we go any further, I do want to introduce David Shenk, who has just joined us. David is the Commissioner of Erie County Senior Services since 2019. He also serves as the Director of County Veteran Services since February 2016. His work history includes serving for 1 year as Erie County Controller and 20 years as Boston Town Clerk. Also, member of the Army Reserves and a storied history of serving in our military. So thank you, David, for joining us as well. So, David, we've just been talking about some questions about stigma and older adults and barriers. So to get you in on the conversation right away, so what do you think are some of the barriers that our older adults face from your perspective?
Well, I think obviously technology, I think is sometimes a barrier. I think that not only wanting to see your grandkids' pictures, which motivates a lot of our grandparents to get on Facebook, but now that with the pandemic, they needed that to have that social interaction, because us humans, we are pack animals. We want to interact. We're not meant to be loners. So I think that was one thing that helped motivate our seniors to increase their rate of learning about technology. And then obviously there is some isolation issues we're discussing. So here at Senior Services, we actually developed a combat social isolation webpage, which Amanda will, I'm sure she'll put that in the chat for me. But yeah, we put all kinds of resources on there. If you guys want to Google it while we're on, just Google Erie County Combat Social Isolation. It'll come right up, and there's all kinds of different museums that have virtual tours. If you want to get into the kangaroo cage at a zoo in Africa, we have the link for it. We have all kinds of cool stuff. And but yeah, I think the barrier is really the knowledge and the IT aspect.
Thank you. So I do want to remind our viewing audience that you can type your question into the comment and we will try to address it. But I do want to sidestep what we've been talking about to address a question that just came through. So I want to have perhaps Nicole address this, that you are working directly with your population. So how do you recommend helping someone, encourage someone rather, who has been institutionalized in their youth and is now afraid any help they'll receive in the past in terms of aggressive treatment, won't be the same? How do we think we might deal with someone like that might have those fears?
That's a really, really great question. So oftentimes fear grows with the unknown. And one of the remedies and one of the ways that we can kind of soothe our anxiety is simply by getting information. So we could simply look at what treatment options are available now and what that looks like. So that might look like calling a place like the Pro Center for Wellness and just asking, can you tell me a little bit about what you guys do there and what it's like? It might look like actually coming and perhaps taking a tour and getting some knowledge and experience of, oh, this is what treatment looks like now, and these are the options available to me. We are really lucky to have an area where there's an incredible array of mental health treatment in Western New York. From the traditional, I'm just talking to my counselor once a week or once a month, to comprehensive treatment programs that have doctors and group therapy and all kinds of activities. So there's a lot of different shapes, colors, and forms of mental health treatment out there. And when we have the information and the knowledge, we can make informed decisions that can soothe a lot of that anxiety. So I would definitely recommend asking a question. What is mental health treatment like right now? What different kinds of treatment are there, and what do I want? And then as you gather that information, that will help you make your informed decision, and that will be soothing in and of itself. When you can see something, when you can go and trial, if you can go and take a tour, that will, seeing the experiences of what treatment is like right now will help with that. It's different than what I went through, and I think I will like this. I think it will work for me and can inspire hope.
Thank you. Thank you very much, Nicole. I appreciate that. And just so our viewers know, we have excellent resources like was mentioned. We have the Mental Health Advocates of West New York, as well as the Mental Health Association of Niagara County. So you could simply Google those organizations and they will come up in numbers or websites, and you can use them as a place to go. And also, of course, Let's Talk Stigma, as you see on our page there, the bottom. You can also, find that link and then use that as a resource to get information. So we have a lot of places where you can get information where to go to help your loved one if they do have those concerns. So getting back to that original question, though, I do want to ask perhaps Melissa. So as far as barriers that you see in your role when it comes to getting help.
It's as I mentioned, a lot of it is just a lot of chronic illness or physical illness that will take precedence. That they may not discuss it with their doctor, and then that's not really getting them the continued assistance that they need. Maybe they'll get prescribed something, but they're not really continuing to work on what is the true concerns, centering more on anxiety or depression as opposed to trying to do things that would help them cope, get them involved, get them comfortable to be involved, get them to stay active with family, not to be so isolated. Obviously, with the pandemic, this unfortunately brought so much of this much more to light. Many of our seniors have suffered greatly, but really educating them. And if we're not getting the word out, getting the word out that it's not the same as it was back in the 50s or 60s, that they'll be able to get a little bit more information if we can get more of that information out there through our programs, services, and things that we offer.
Thank you. And so, Nicole, any comments about this?
I think one of the main things is if you have a support system, if you have a family who can help you navigate, online portals or just trying to get information, that's really great. But one of the barriers that older adults are facing is some people don't have family, they don't have supports who are able to sit with them and perhaps help them as they link. We've already named my previous panels. People have already named issues of transportation, issues of finances, but also having a supportive person who can help someone who's unfamiliar with a system or a program navigate or link to these services. Sometimes individuals are isolated and that support system is just not there. And these individuals are truly struggling to get information and to get assistance in accessing some of the great services and treatment options that are available today.
So I know, thank you. And I know, David, you mentioned some county resources. Amanda, do you have any others to add that might help with addressing this issue of barriers that might be able to help?
Yes, so here at Erie County Senior Services, we collaborate with the Erie County Department of Mental Health on an older adult project, which also includes Jewish Family Services and Catholic Charities Project Hope. Through this program, we provide assessments and linkage with other services, whatever services the client might need. And to access these services, you would call our New York Connects hotline. The number is 858-8526. And when you call New York Connects, you'll speak with a case manager who can provide information and assistance and linkage with all community resources. So that's a great number for folks to have to call. Another program available is our insurance counseling. So there was talk of concerns about co-pays and doctor visits, those types of things. We have a health insurance counseling program where it's free. So we provide unbiased information to folks, and we can let them know what your insurance would cover, what it might cost you. So that's another great resource here at Senior Services. And then we also provide transportation, which has been mentioned quite a few times. We have our Going Places van system, which provides transportation in most cities and towns in Erie County. If we don't provide it, we'll link you with the correct service. But this service can get you to your medical appointments, as well as other social activities like going
Shopping.
grocery shopping, going to a senior center, going to get your hair cut. So again, another great resource. And their phone number is 858-7433. So folks can call to register for that. You can also check out on our website. I think Dave put it in the chat. There is our social isolation page. But also we have what's called a guide to services for Erie County. So it lists all different types of programs and resources throughout Erie County, and it'll give you the phone numbers to call. So it's, again, another great resource. And we actually have paper copies of those that we can mail out to folks as well. If they call New York Connects, we can get them out or make them available to different agencies to have on hand for folks.
That's amazing. So I think what we're hearing here is that, yes, there's barriers, but fortunately in our area, we are very well resourced. I think the idea is, and I learned this real briefly when I worked at the MHA, the Mental Advocates. I worked there for 4 years. And there is the information referral department, and then they would receive a countless number of calls every week, every year, that point at the fact that people many times just don't know where to go. They don't know where to turn. And so I think one of the things we're talking about here in terms of addressing these barriers is getting the information out in a way that is easily accessible, right? Be able to make it so that folks can find it. And I think if they just get pointed in that direction, that'll go a long way when it comes to getting people help. So once again, if you have a question, please type it into the comment box. And I do have a question. So what do family members need to look for to see if their older relative may be experiencing a mental health issue and how to support them? So I'm going to ask Nicole, once again, one of our primary clinicians here, seeing that you do clinical work. So what do people look for in their older relatives?
So that's another great question. One of the great telltale signs is acting in a way that's different than how they've acted previously, having a big change in their personality or a big change in functioning. Oftentimes, mental health will come out with our behavior and how we take care of ourselves. So you might see people who have previously appeared very fastidious and tidy, suddenly looking very unkempt. You might see somebody who has typically been, very polite and amiable, suddenly showing a lot of anger. Or it could look like physical symptoms, people being hungry all the time and not knowing why, people being exhausted every day, even though they're sleeping. Or you might simply see people just stop talking. Older adults will sometimes stop reaching out, they'll stop calling, they'll stop responding in ways that they previously have in the past. And these are very subtle differences that can be a sign that they're not feeling okay, that something is wrong, and that they might have some mental health.
So, and then, so say you do see these things and you're concerned, what would be your next steps?
Definitely encouraging them to link with some place or someone that they feel safe with for support. Typically, most people are comfortable going to their doctor, starting with their primary medical doctors. I notice that you're sleeping all the time, but you never feel rested, and it seems to be harder for you to maybe take care of yourself. Why don't we first make a doctor's appointment? Most individuals have worked with their primary medical doctor, sometimes for years and decades. So this is a really great place to start. Another great way to start is simply calling around to some place like the Mental Health Association or any of the great treatment places, providers, and saying, I've noticed so-and-so has these things, and I'm a little worried about them. Often, no matter who you call, they can connect you with really great resources or the right organization or the right person who might be able to help you, whether that be a senior center, whether that might be community outreach or a little support group. They can send you on a journey that will lead you hopefully with getting some information that you can make really great decisions of and be a supportive advocate for.
Thank you. That's excellent. Of course, once again, to remind our viewers, you can go to the Erie County Erie County Anti-Stigma Coalition page at letstalkstigma.org and look under Resources tab, and you can get that information on where the resources are in the area that you can tap into. So let's shift gears a little bit, and I'm going to ask another question. So this is, of course, for David and Amanda. As representatives of our county government, for Erie County, what programs are available? Like we said, we talked about this, but we talked about the online resources. Is there anything else you can add that perhaps we haven't touched on yet?
Just the other couple programs I mentioned as far as New York Connects and our case management program. We have case managers that can link clients with services like home delivered meals, home care. So if they need an aide to come in and help them with things, as well as social adult day programs. We also have.
Want to talk about consumer directed?
Yes, actually, a program that we're really trying to push is our consumer directed program, where a client can have either a friend, neighbor, relative help them with any tasks. The client develops a care plan themselves or their caregiver if they're unable. But this person could help maybe grocery shop or do cleaning, cooking, the typical things that a PCA aide might do. So it's totally directed by the client or caregiver. And as long as they have somebody that can fulfill this role, we can get them started right away on this program.
I'm sure we've all seen those commercials on TV where the African-American gentleman sitting in his recliner, and is waiting for his coffee, and his daughter is at the Keurig and brings it in. They smile. Or there's another one, similar commercial, with another family, and that program is for people that are on Medicaid. Okay, the big difference with county government is, and social services, there tend to be programs that are Medicaid driven, whereas we're non-Medicaid driven. Okay, so a lot of our programs are designed and funded by the state and federal government with the goal is to keep people off Medicaid as long as possible, keep them from going into the assisted living or the skilled nursing facility. So like Amanda said, if let's say Karl's dad is struggling and it starts off with, hey, Karl, can you cut the grass or can you shovel the roof, snow blow, and now it turns into I need help with paying my bills and those other things, and I don't want to go grocery shopping anymore. I get too overwhelmed. I can never find what matches my coupon, whatever. And then so Karl's doing that, right? But he already has a house, a spouse, a dog, 2 kids. He's working 40 hours. He's active in the community. Now he's giving his dad 10 hours a week. So he's getting stressed out. And his kids are losing their time. He's missing those baseball games. So what this program is designed to do is, let's say Karl says to his boss, I want to go part-time. So now Karl works 30 hours where he's at and works 10 hours, and he's getting paid to work for his dad. So it increases quality of life for everybody, not just the caregiver and the senior, but the people that are touched by them as well.
Excellent. I do have another question, but first, before we get to that, if you're just tuning in, I'm Karl Shallowhorn from the Erie County Anti-Stigma Coalition. I'm joined by David Shenk, Commissioner of Erie County Senior Services, Amanda Bender, Long-Term Care Coordinator for Erie County Senior Services, Melissa Abel, Deputy Director of Amherst Center for Senior Services, and Nicole Dunlap, Clinical Supervisor for the PROS Center for Wellness for the Dale Association in Niagara County. So we did have another question come through, and once again, if you have a question, please type it into the comment box and we'll pass it along. So I would just say anyone who'd be willing to answer this, because I think there's different perspectives, but what do you do if you suggest help, but your loved one resists it? And we know that is certainly common, where you see the things like Nicole, you were saying, well, you've noticed things, you see things, but then you encourage them to help. What do you do if they resist? So what do you think?
So oftentimes people need to hear things several times and mull them over before they're comfortable making a decision, especially something that might be fraught with previously held beliefs or fears like treatment. So one of the best things that we can do is we can bring something up, or we can make a suggestion, and then we can let it sit and give it some time and continue to bring it up organically and authentically in different situations where it's appropriate to say this. Someone might need to think several times, oh, maybe I do need some help, before they're actually ready to get help. So not just bringing it up once and then, oh, I tried throwing up my hands, they didn't take my suggestion, but maybe suggesting it over time, several times, being educated and having some information so that when you do revisit a conversation, you have some ideas or you have some information that might be soothing. I've actually looked into this and this place looks really great, or I know somebody who uses this great care management program and they were really stressed and now they're feeling great. Having some examples, or reaching out and just knowing more yourself. Oftentimes we can use ourselves as personal examples, and we can say, you know what, I've struggled with this and I'm considering also getting some support. I'm considering maybe talking to a counselor. I've talked to my doctor about this and it's helped me to feel better. Or trying to link them with an individual who's been in similar circumstances, who now has their life improved because they have home delivered meals, or they have a loved one who's now working for them as their aide and getting paid for it. So instead of it being this very scary thing that we're just anxious about, we're just pouring over, we have concrete real world examples and people that we can talk to who benefited from these programs, or just more knowledge that we can bring it up when it's ready, when the opportunity presents itself, to say, you know what, I know I already talked about this, but maybe we should think about getting you a little bit of help. What would that look like? What would you want to change? How would you want to feel different?
I like that. And I think another thing I hear you saying is that idea of just offering options, right? When you offer options to someone, many times they will pick what they feel is best and they're more likely to follow through. That's one thing I've learned also myself. So Melissa, back to you. So at Amherst Senior Services, you work with the broader community. And as far as the mental well-being of your members, of your clients, what do you see as being their critical needs in terms of just the general public? Because of course, I know we're talking about individuals that are dealing with maybe mental health challenges, but what about just overall mental well-being? We know that we all have mental health. So what are some of those things you would consider there?
For us, we're, encouraging people to get involved in the senior center, encouraging people to stay involved in their community. As their needs will increase as our population is increasing. So every time, we get new senior housing or new communities that come up in the area, the needs will increase and they'll vary. Amherst is a very diverse community. Each kind of has its unique, whether it's Eggertsville or West Amherst has its unique neighborhoods. We look at if they're socially isolated, it's going to lead to so many other issues, increased anxiety, increased depression, increased chronic illness. For us, the critical need is to be able to get out and to do more outreach, go back into these neighborhoods. We get so many people that come into the center as it is, but in the last year and a half with technology issues and that, we've really helped to educate a lot of our seniors on how to use Zoom, how to get on so they can Facebook with their families. But when we continue to have that digital divide, that's going to continue to make difficulties as far as getting help. So the more that I think that we can educate, the more that we can offer here at the center, the more support we get from the community as well, to be able to offer more. We've created a new grief and loss group that actually came out of the pandemic. We've had widowers and caregivers groups. So those are on the rise as far as attendance goes. We're trying to do much more via social media so that we're reaching out to more. And then really, like I said, getting back out to the community, talking about things, seeing what they need and what we can offer and what other things that we can do here at the center to be able to keep people active, keep them educated, keep them talking and staying in the conversation. The more that we can educate on mental health, the more that we can talk about it, keep it out loud, and not just within, and not even just within the family. The more we can talk about trauma and getting more trained geriatric mental health professionals involved, I think the better. We're aging in place, and we want to make sure that we can offer as much as we can here at the Senior Center.
I just want to make a comment real quick, Melissa. You just said trained geriatric mental health professionals. And that's a really good point, because we know that older adults do face different issues. We do know there's even issues with dementia and Alzheimer's that may also have features of mental health associated with it. So we do need specialists who are able to identify what's happening with your loved one and can help. So that's a really great point. I'm glad you said that. So remember, also for our viewers, you can visit our website at letstalkstigma.org to take the pledge to end stigma. Also, if you're connected with a business, organization, or faith community, you become an organizational member. You can find more information for this on our website under the Members tab. So, Nicole, back to you. So, at the Dale Association Pros Wellness Center for Wellness, what do you see in your clinic? Of course, you have individuals who are maybe more severely affected with their mental health. So what are your observations, and what do you think you're doing to help them?
So one of the needs of most of our clients, and I think maybe the general population as a whole, has to do with social connection and the lack of a support system, the lack of meaningful connection to other people, and loneliness. And what we're seeing, researchers have shown that loneliness is just as lethal as smoking about 15 cigarettes a day. In terms of a health risk, it rivals things like smoking or obesity. The need to connect to others in a meaningful way colors how we feel, and it colors how we live our lives. And one of the things that we typically see with individuals who attend my program is they're very isolated, and that meaningful connection has stalled or sometimes has stopped. One of the very frequent things we see for our individuals is that they're only leaving their homes to maybe go shopping or go to medical appointments. And it's very hard to have a robust mental health if your only social interaction is coming from medical providers or the people who are checking you out at a grocery store. So one of the ways that we can improve anybody's mental health is making sure that they are connected in meaningful ways. So one of the benefits of a PROS program is that we offer group therapy. And so it's a chance to be in the presence of other people. It's a chance to connect with people who we find have gone through similar experiences to us. We can have knowledge that, oh, it's not just me. This hasn't just been my story. There are all of these people who have this symptom or who've had this life experience or who've struggled with that way. And it's a chance of giving support to other people and having that nourishing social connection. Knowing that you're not alone and knowing that there are people who will help pick you up, give you some support when you need to, is a very powerful tool. One of the best things we can do to someone who feels lonely is to give them opportunities to connect with other people in meaningful ways.
I can't agree more. And I know, and certainly because of COVID, look what's happened. I mean, we've all had I think some sense of isolation, but even those older adults who lived alone, perhaps even more so, and it has a profound effect on them. So thank you for raising that point, Nicole. So this is another one for all of you. But first I have a question. Is mental health messaging added to other senior programs not directly related to mental health? So I guess I would throw that to Amanda and David. So any mental health messaging added to other senior programs that you provide that aren't directly related to mental health?
Yeah, Amanda and I were just kind of chatting on that. What we try to do during our nutrition and wellness, we often use the home delivered meal program. We have a contract with Feed More, Kenton Meals on Wheels, and Amherst Meals on Wheels. And oftentimes periodically we'll have them attach a flyer that'll advertise our combat social isolation page. Our University Express is a wonderful program. It's based upon the model of how a lot of the schools have adult education in the evening, right? And those could be classes, anything from volleyball to camera to artists, to financial planners, life planning, estates, all kinds of stuff that adults, not necessarily seniors, but adults are interested in. So we took that model and then we crafted it for seniors. And I'll put the website up in a second. But so I think we have 70 different instructors. Once COVID hit, it used to be an in-person session. Like I used to teach a class talking about my deployments to the Middle East and the Army Reserve and the Medical Corps. But I used to go to four senior centers, all right, and teach the same class. So my commitment as an instructor was probably, with driving time, upwards of 10 hours. And so due to COVID, we did it all through WebEx, which is the video teleconferencing software the county uses. So now I'm able to teach you once from my desk. So that helped increase the number of instructors. We got to the point by this spring semester, just ended last week, we had 2 sessions every day, 10 a.m. and 2 p.m. for the entire semester. So we've really got an increase. And then we started a hybrid program last fall, which we continue now. So we say to the senior centers, would you be willing to host an instructor in person? And we'll broadcast that instructor right from there. So these are some of the things that we've tried to advertise with, being able to reach out to seniors through our nutrition and wellness in the senior centers. Oftentimes we're bringing out those brochures for those other things that help the mental health aspect for seniors.
Excellent.
Anything, Amanda?
No, that's great. Thanks, Dave.
Thank you, David. That's a great response. So, basically, I want to also ask, as far as one of the issues, certainly I just mentioned was COVID, and certainly COVID has affected all of us. But what about older adults, and what do you feel are your concerns? This is for everyone, about the effects of COVID and older adults' mental health. So perhaps we'll start with Melissa. What do you see as being some of the concerns that you may have had? Because of course your center was closed.
Yes.
And so what do you see as being the effects?
Yeah, we were closed for quite a while, but we automatically shifted to online programming, which we were very fortunate to be able to do. We started going out into the community and doing a lot of events in parks and other outdoor locations. But a lot of the effects that we have seen, and which will be long-lasting effects, is lack of regular screenings, regular exercise, regular social contact, and as David mentioned, that we like that pack. We like to be together. There's a lot to say about things being put on Facebook and Facebook Live and all these other great platforms that we have. But if you're not one-on-one, you're not in the same room with somebody, it's just not the same. It's almost been, the decline for some of our seniors has almost been shocking. We automatically went to, as I said, online programming and delivering meals. But when we've had people coming back into the building recently, the aging and how quickly the physical decline in a lot of our seniors has been very shocking. Not going to screenings and other, if they weren't able to participate in telehealth, anything like that is going to increase their physical and chronic illnesses. Those social supports, as I said, focusing on trauma and the effects. We don't know how that's going to affect. Loneliness increases, dementia, and other cognitive decline. So how is that going to affect as time goes on, and whether other effects that we're going to see? The increase in technology was great for a lot and many, but unfortunately our seniors get left behind in many occasions. They don't have access, don't know how, don't want to, and then many did. So unfortunately, without being able to close that digital divide anytime soon, we're offering a lot, we're trying to educate a lot by doing that, but still we saw a lot of resistance with that. So again, it's been shocking. It's still a fear of many to come into the building. Yeah. In the programs that we do, we're still staying out in the community, still doing exercise classes and other things in the park, so they don't have to actually come into the building, even though we've made it as safe as possible. But at the same time, we're probably about a quarter of the people that we would normally have in our building each day. And that's huge for us. About a quarter. We're getting we're getting about 200 or so per day, but we were getting upwards of 800 or more. We have a very large center, and we're very fortunate for that. But, we're trying to increase those services, increase that outreach, increase the support through our social caseworkers, staying connected with our partners, with Erie County Senior Services, offering referrals and everything so that, that we can be able to assist and see as time goes on how these effects are going to be happening with our seniors.
Thank you for that. And Nicole, how about you with what you've seen with your members?
Well, I'll echo a lot of the points that Melissa has made, which is there is a lot of anxiety associated with rejoining the world and reemerging into what we used to do prior to the pandemic. And so I see a lot of social anxiety. I see a lot of trepidation and discomfort over things that we didn't even used to think about. And one of the impacts of that is people who have been home for a year and a half suddenly feel unsafe leaving their home. And we see symptoms like agoraphobia. We have people who are now changing the way that they live their lives quite dramatically to accommodate their anxiety, and a loss of social skills. I used to connect people in this way, but I've been so out of practice that now I feel awkward or emotional when I do that. And so it's extra uncomfortable. So some rejoining the world anxiety, and also kind of remembering how we used to socialize, how we used to connect with other people, and trying to pick up the threads of the lives that have been put on pause.
And so Amanda, David, any comments?
Well, I definitely think that as humans, we have a lot of habits. There's the handshake, the hug, the kiss on the cheek with people you're close to every time you see them, a hello and a goodbye, and we tend to sit closer unless we're in a big conference room, because we are, like I said before, we're pack animals, and that's what we do. And then COVID made us change those habits. And then I noticed here at the Rath building, employees that, we had to come in at least one day a week, depending upon your job. Like Amanda's staff was coming in more often because we had IT challenges. We couldn't let them work from home as much as we would have liked. So then we had to get into the habit of when you rise from your desk, you put your mask back on, because you could be coming within 6 feet. You don't know what you're going to encounter as you walk down the hall. So now we had to develop that habit. Washing your hands more often, though I don't think that one was big of a change. I think most people were pretty good about doing that. About sharing food, eating serving off the same container. So a lot of these habits they had to change. And I think a lot of people were initially resisted. They got used to it. And now we're starting to come out of it. I'm really talking before the Delta variant really kicks in full gear, but now we're beginning to change those things. Amanda and I are sitting here, we're only about a foot apart. And if we were doing this a month ago or before we got vaccinated, before the county work policy changed, we'd have had our mask on. We're both vaccinated, so we don't have to wear a mask. So I think people are having to relearn, like Melissa mentioned, we have to relearn our habits again. And some people have trepidation. It's funny, I was late because I had a meeting up in the county executive's office with representatives from Feedmore. And we just lifted the rule. If you are vaccinated and you've got a sticker on your county ID, you can see the little orange sticker, that means I'm vaccinated. I don't have to wear this in the elevator anymore, okay? But now I'm in a meeting with strangers, visitors, non-employees, which we have no idea if they're vaccinated. They're supposed to wear a mask throughout the building. They all came in, none of them had a mask on. And I'm like, I'm the only one with a mask on. I'm like, I thought they're supposed to have one on. I thought I'm supposed to have it because I'm interacting with visitors. But there was a new policy change last week, and I didn't read the whole thing because I don't get that many visitors. I talk on the phone.
Yeah.
So these are things we've got to relearn. And guess what? Once we learn them, they're going to change again in 2 weeks.
Right.
So I think we're playing catch up all the time. That's frustrating.
Yeah, and I think, of course, these adjustments are things we're all going through. Absolutely. So we have a little bit of time left, but I do want to get to this one question for all of you that I think would be a good way to kind of provide folks once again with some takeaways. So, in terms of the overall advice you would give to our viewers about being caregivers, say for a parent, relative, or even older sibling, what ways can you support your loved one? I mean, we've talked about a number of things they could do, but what are just some of the general ways you can support your loved one? So perhaps we'll start with Melissa.
I would say have a conversation. Definitely start with a conversation. Listen, be non-judgmental. Don't be surprised if, there's a reaction. As we said before, kind of reapproach as needed. Definitely link them to services, get educated, whether it's linking to Erie County Senior Services, other mental health agencies, getting them involved in their local senior center is a great thing. I can't push that more. But keeping them involved in any of the decision making too, so that they're aware as to what's going on as time goes on. So I don't think you're talking behind their back or anything.
Yeah, I love that idea about involving them in decision making. Like I said earlier, when you offer someone options, or if you bring them into it instead of just making the decision for them, they're more likely to follow through. I know, to share my own brief experience with my dad, he wasn't dealing so much at the time with any kind of behavioral health issues, but when it came even time for the power of attorney, which we know sometimes is consideration for folks, we had the conversation, and he was agreeable to that. So when it came time to go to the attorney, he was willing to do so, as opposed to, we talk about resistance and so forth, which can happen. So we want to bring our loved one in as best as possible so we don't have that kind of resistance. That's absolutely a good point, Melissa. Nicole, how about you? What do you think as far as ways we can support our loved ones?
One of the things we could do is we could ask them, how are you doing? And then follow it up with, how are you really doing? And just asking again and just putting a little emphasis. You'll be surprised what people will tell you if you give them a chance to. And then offering to listen. Do you just want to talk about this, or do you want me to hear about it and maybe offer some suggestions or give you some advice? Or do you want to just let me listen and hear what you have to say? It's very powerful to give an individual an opportunity to let you know how you're really doing, and then to listen genuinely to you. The other thing we can do is we can be a partner. A lot of linking to new places, trying new things, or going back out to the world again makes people anxious. So you could be that safe person. Hey, why don't we do this together? Why don't I go with you when we look at what kind of programs are available at the senior center? And the other thing that we can do is we can talk about our own mental health. We can normalize talking about how we're feeling, how we're struggling, and what we're doing constantly to improve our mental health. We can talk about how we're managing our stress. We can talk about reaching out for help ourselves. And the more that we normalize mental health affects everybody, the better we all can feel.
That's awesome. And I wanted to say one thing. Listening is huge. And also the idea of going with someone. I know even it comes down to, like we talked about before, if we do have the opportunity to say to someone, this behavioral health service, for instance, is available, I'll go with you, which could take away a lot of that fear of going. So that's a great point. So David, how about you? What would you say as ways we can support our loved one?
Well, I think it's about maintaining a good and effective communication. I've said for years, I think the world's worst problem is poor communication. I don't think it's drugs. I don't think it's alcohol. I think it's poor communication. Because if two people communicate effectively, they can work out any issue. So let's apply that to the senior at home. If you go by and see dad, and you talk to him and you find out what he's thinking, and help him with what he's doing, and make suggestions and find a way to effectuate a change, do it in a fun way. Like Nicole had mentioned about, going with dad to learn about the stuff, make it a group project. I think those are all great ideas. Amanda, do you have anything to add?
Yeah, it's just to kind of piggyback on what was already said, to keep the conversations open, to let them know they have someone to talk to. I did want to mention for our caregivers out there who may be listening, through Erie County Senior Services, we also do provide caregiver counseling. We'll provide up to 6 free sessions, more if needed. But these are really great because they can actually meet the caregiver anywhere in the community, at their home, at a Tim Hortons or wherever. So just to know too that those caregivers are supported as well.
Can I ask a question? Actually, this is for either of you. What about respite services? I know sometimes that's something that might be a concern for someone, especially if you're doing something in home. Any thoughts about that?
As far as what respite services are available, or?
Yeah, that might be available for caregivers.
Sure. So our main form of in-home respite is obviously our home care services. So where an aide can come in and help with daily tasks, might be food preparation, laundry, cooking, cleaning, those types of things. As I mentioned before, consumer-directed program. If they have a family member who might be doing these things, this is an opportunity for them to get paid for doing those things as well. So certainly by calling New York Connects, you can discuss your situation with the case manager, and we can link folks up to have an assessment.
Terrific. So this has been an awesome conversation. I must say, this has been wonderful. I think, we've learned a lot, and hope that our viewers have too. So I want to give each of you a brief moment, less than a minute or so, to maybe give some final, statements about this topic and what you think people can take away. So, about a minute or so. David, would you like to begin?
Sure. I think with us and seniors, the number that you need to have by your phone is 858-8526. That's our New York Connects hotline. That's our intake center. That's where you call to get a pre-screening for benefits, whether you want to go to congregate dining, home delivered meals, respite, home care, a home visit, referral to adult protective services. Pretty much that's where you start. That's the number they need to know. That's the number that needs to be written down by the phone. And it all just goes right from there, 858-8526. And if you can get your senior online, whether you buy them a smartphone, add them onto your home plan, or it's getting them an iPad or whatever and getting them onto our website, and they can find out even more. And follow us on Facebook and on Twitter. We have a person that's dedicated to that, and she posts anywhere between 2 and 8 times a day. And we promote the programs of our partners in the community as well. Amanda?
Thank you. Melissa? How about you, Melissa?
For the Amherst Senior Center, I would say, stay involved, contact us anytime at 636-3050. We're also on Facebook, our website. We have numerous classes, events, supportive services here. Our outreach staff through Erie County is fantastic. We have social caseworkers here on site. Just stay in the conversation. Just learn as much as you can. Keep it open. We can have more conversations like this. I think just getting people more comfortable, the more they can stay active physically, taking exercise, yoga, anything like that, eating regularly, staying socially active, mentally healthy, taking mindfulness programs. We've started a lot of that here at the center. Support groups, counseling. Again, the more they can stay in touch, learn new skills, try to get access to technology. Get some of those grandkids that can help you with that. And we also offer computer classes here at the center as well. And when we get student volunteers in again too, they've always been a great help to us. So again, just staying really, if you join the senior center, it's Amherst or outside of Amherst, we offer a very safe and welcoming environment for all. Thanks. And all are welcome to join here.
Thank you. Amanda, anything to add to what David had to say?
No, I think he did a good job summarizing it up. We always look to advertise New York Connects because we have case managers, that will answer your call Monday through Friday from 8:30 to 4:30. So please feel free to reach out to us.
And your calls are answered locally, internally.
Yes.
Great. Nicole, we'll give you the last word.
Number one, everybody has mental health. Just like we wouldn't be angry or upset with someone who was diabetic, who needed insulin or needed to go to the doctors, we shouldn't feel bad about needing to go to the doctors or needing to talk to someone about our emotional health. There are different things that we do every day that can support our emotional well-being, whether that's relaxing or calming or soothing or genuinely connecting with other people. The first step is to talk about it, whether you just talk about how you are feeling and your own mental health, or you're asking someone you care about how they're really doing. Talking about mental health is one of the most important things that we can do, and giving it the same importance as physical health. Knowing that it's okay to reach out to help, it's okay to talk to somebody, and it's important and vital too. The second thing I'll do is I will plug my program, the Dale Association Pro Center for Wellness. We are a group-based program. We can additionally not just provide mental health counseling, but we can also help with structure, with social supports, and with an environment where you are around other people who have been through the same things you have, who've gone through what you have, and can connect and support people. The Dale Association also has the Senior Center. We also have a respite program, a caregiver support group, as well as just social aspects like knitting or bingo or any of those other wonderful fun group activities we've been missing out on for the last year and a half. So if you'd like to come to Lockport in Niagara County, check out the Dale Association Pro Center for Wellness or the Dale Association Senior Center. You can call us at 433-1937.
Thank you very much, Nicole. So as a reminder, we need you to take the pledge on stigma by going to our website at letstalkstigma.org. If your organization would like to join us in our cause, there's information on the website, like I mentioned before as well. Just click on the members tab to get that information. So together, we can all make this happen. So once again, I'd like to thank our panelists, David Shenk, Commissioner of Erie County Senior Services, Amanda Bender, Long-Term Care Coordinator for Erie County Senior Services, Melissa Abel, Deputy Director of Amherst Center for Senior Services, and Nicole Dunlap, Clinical Supervisor for the Pro Center for Wellness for the Dale Association. I'd also like to thank the folks behind the scenes from Telesco Creative Group, Mike Telesco, and also Matt Smith, Chair of the Anti-Stigma Coalition Outreach Committee, and Carol Doggett from the Mental Advocates of West New York and the Anti-Stigma Coalition for her support as well. Be sure to tune into our next Facebook Live in September, Off to College, supporting your students' mental health. So on behalf of the Erie County Anti-Stigma Coalition, until next time, I'm Karl Shallowhorn. Be well.